In my introductory video, I put forward the argument, whilst it's imperative to deal with the immediate challenges related to COVID-19, now is also the right time to start treating patients that have been waiting for care. We know the lasting impact of the pandemic will be felt for decades, but acting now to ensure we are able to deal with significant levels of demand as a result of treatments and procedures that have had to be postponed will, at the very least, reduce some of the pressures ahead. But how?
Let me talk you through a case study in community services, where a real focus was on addressing the backlogs and waiting lists and the cost pressures that were associated with this. We had engaged with the Trust on 2 previous occasions, working within the Physical Health Directorate. Following on from the success of these projects, we were commissioned to undertake a further analysis across the entire organisation. As part of this programme of work, we were tasked with supporting the Trust to achieve a SIP saving of 1.18 million across the remaining 3 physical health directorates. These directorates included district nursing, therapy services and other specialist physical health teams, including 4 rehabilitation inpatient wards. We conducted an analysis during the first few weeks of the project and found the following. No overview of capacity or expectations of work targets within the teams. Different working practices within the different localities in respect of allocation, patient care and management. A lack of management control across the different services and between teams within the same service. Consequently, a lack of clear understanding regarding demands upon teams, resulting in spare capacity and overspend of bank and agency. We embarked on a 28-week project with the physical health services across 3 localities, 30 community teams, 246.1 whole-time equivalent, and 4 inpatient wards, 95 beds. Within the community-based teams, we supported the development of a range of management controls to improve the planning and allocation of work. These allowed easy monitoring of pathways in terms of frequency and intensity of contact and support, and supported the achievement of agreed targets. Following the successful installation of the requisite controls and the embedding of necessary management behaviours within the Physical Health Directorate, the results were as follows. Against a SIP target of 1.19 million, there has been a cash saving of £247,640, identified saving of a further 1.95 million, with 1.4 million coming from therapies and 550,000 from within the district nursing teams. Productivity increase of 31% within the DN teams, from 6.2 to 8.1 contacts per whole time equivalent day. Average of 21% increase in productivity across the therapy services against the base. Consistency in expectation and workload across the division, including follow-up work in the 2 previously worked with areas. And clear targets across each of the teams in terms of a percentage of work time spent on direct clinical contact. This ensures that all staff are working to the same expectations.